Do you have a hypertonic pelvic floor? Does it hurt if you're having sex? Is it difficult to have a bowel movement? This might be signs of a hypertonic pelvic floor. I'm Dr. Wendy, physical therapist. I've taken care of women for 17 years, and I got a question about a hypertonic pelvic floor, and I thought, you know what? I haven't made a video about this, so let me tell you some things. Your pelvic floor is made up of these muscles called your levator ani. And your levator ani is actually held to the rim of your pelvis by an obturator internus, which is right in here. Now, your obturator internus is actually a hip muscle. So a muscle that goes to the hip helps the pelvic floor stay tight. So I have a lot of people that have pelvic floor tightness and hip dysfunction. If you have a labral tear, you might have pelvic pain. But that's not this video. So pelvic pain, hypertonic pelvic floor, what do? If you have a hypertonic pelvic floor, it means the muscle activity is too high and we need to bring it down. Now, you can do Kegels in this particular group, but you may not do it the way you think. I like to think of a weak and hypertonic pelvic floor as a child that doesn't know how to do a jumping jack. Have you ever seen a little kid not know how to do a jumping jack? They can't time it. The arms and legs are not doing the right things. A hypertonic weak pelvic floor is just that. So if I have somebody do Kegels with a hypertonic pelvic floor, it's really barely a squeeze. I actually put all the weight into the actual rest. So let's say, for example, you could do 5 to 10 reps holding 1 second, just 1 second, but we're gonna have you relax for 10 seconds in between. That relaxation is the greatest, most important piece of your exercise sequence, believe it or not. So you're gonna squeeze for 1 second and then drop it right back down. Rest, 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 and really truly rest. We want you to focus on that. We want you to breathe. And then when we say contract, jump up, let it go. Rest, 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 rest. A women's health therapist will have oftentimes a surface EMG to help you see that on a screen. And I would say you could do this at home, focusing on rest. Now, something that's interesting, if you look at videos that people talk about pelvic floor exercises, child's pose is listed as an activity that can strengthen and stretch the pelvic floor, and I would agree. So if you have a hypertonic pelvic floor that is weak and tight, child's pose is the pose for you. A deep squat, a deep frog squat, providing it doesn't hurt your hip, but these are a few places to start. Hope this helps.